welcome to the third New Zealand Doctor podcast. We're doing something slightly different this time. We're with a group of students from the Auckland University's Grassroots Club visiting the Eastern Bay of Plenty. And we're just going to head off into the Whakatane hospital and have a look around there. The rest of the day, we're looking forward to an ambulance and fire scenario, surfing lessons, and then a social evening doing professional speed dating after Scottish country dancing. So it's going to be a fun time.
Hi, my name's Chelsea Ickersley. I'm part of Grassroots Rural Health Club. What Grassroots is about is it's a rural health club at Auckland University, and we promote getting students from out in rural areas to do the health fields like nursing, optom, med, pharmacy. It's a pretty chilled out club. This is one of our trips. This is the average backdrop for our trips. What we try to do is bring everyone together and show them things which they may not have the chance to see, and they usually spread the word as well, so it gets out there a lot.
So good morning, my name is Brian. I'm a third year medical student from Auckland University, and today we're here with Isabel. She has just finished her 4th year of pharmacy and is about to start her work in the community pharmacy. Now Isabel, could you tell us a bit of why you've joined Grassroots and what has attracted you to the Grassroots program?
Right, so I'm very pro rural health, and I'm always keen to look for any opportunity for interprofessional learning. So we're in the sunny Whakatane on a Saturday morning today, just outside the new hospital.
And what have your thoughts been about Whakatane so far as a rural community?
Well, it's very sunny, very, very sunny, and everyone here is really friendly, and we got a really good feed last night, and we're going for some Scottish dancing tonight, so see what the Scottish community has to offer this evening. So I'm excited.
So here we are at Blueberry Corner, just outside of Whakatane, at the end of our Grassroots weekend. I'm here with Chelsea from the Grassroots Club in Auckland. On Saturday, we started with
Hospital tour?
the hospital tour, that's right. And the junior doctor took us around there. Tell us a bit about that. How did that feel?
So that was really interesting because I know a lot of people on the trip haven't even been around the hospital unless they've been there themselves. So for them it was the first place they've maybe seen, which is a good thing. It shows what not necessarily a big hospital is the norm.
Yeah.
And me being in a big hospital this year, I found it interesting seeing the size difference, and sort of it's a lot more quiet, but everyone seems to know each other and have each other's back. And
the house officer who took us around, Kirsten, she said that one of the advantages of being in a smaller place was that because you didn't have the more senior staff above you, you actually got to do a lot more of the hands-on stuff as well, which I thought was quite interesting. You know, I think that is true of a lot of provincial and rural places, in all sorts of roles that you do get more practical experience around a sort of actually fair breadth of things as well. So I thought that was really good.
And I know a lot of people in our year might feel it's a lot more scary without registrars, but she felt the same and now would have picked that as her option. So that's good to know.
Yeah. And then we went on to
we went to the emergency scenarios.
Yes.
So firemen.
So here we are outside the St. John's depot of beautiful Whakatane, waiting to get our introduction to some fire scenarios by the staff at St. John. We're very excited to look forward to this. Hopefully we can really learn something new about what it is that St. John does and how they play the integral role that they play in the health system for New Zealand.
So pleased to have the local volunteer fire and ambulance people. You know, they're enthusiastic about what we're doing and engaged and providing those services. What was the highlight of that?
It would have to be being ripped out of a car by the fireman.
Yeah.
That was amazing. Didn't think that would ever happen in my life. No. Fingers crossed. Yes. But it did. And now I'm fine.
Yeah, it looked pretty dramatic.
Yeah.
So that was really good. Right? I certainly enjoyed watching you being ripped out of the car by a fireman. I'm very glad I wasn't inside the car being ripped out. I thought it worked really well the way that they engaged everybody in the activity as well. So you practiced using a backboard and the neck collar in several different sort of settings with different patients, and then moved into the vehicle to extract somebody from the vehicle as well. And then the ambulance crew demonstrated how to take the roof off a car as well. And so It was really good. I thought that was an excellent sort of session.
And that was very applicable. I found everyone getting really into it as well.
Yeah.
It wasn't like a doctor thing.
No.
Everyone was loving the car.
Yeah.
Ripped open.
Yeah. I hope that most of the activities have been ones that have engaged everybody of all the different specialties. It's a very, it's really about demonstrating what the area is like, but a lot of it is about just the interprofessional relations as well, and sort of getting to know each other.
We're here at the Opoki fire station in St. John's Depot, and we're here with Manshu. Could you tell us what you've done this afternoon?
Yeah, so today we've had the pleasure of watching a car being cut open live. I was actually one of the passengers inside, mimicking a drink drive student, and the car was just cut open. Yeah, it was pretty awesome. We've also run through some simulations of the ambulance.
Cool, Manshu. Can you also tell us how this will impact your future experience should you come across a scene such as the one that you experienced today for real?
Probably the biggest thing is just knowing what happens, because I haven't seen one of these before, so you just know what happens, and so you kind of know where you can fit in and help out if need be.
Thank you so much, Manshu. I hope you enjoyed the show.
Cheers.
And we'll hear from you later.
So after the emergency scenario, we went to the Manuka Tuatahi Marae,
Yep.
the Mātātua Marae, and had an introduction to some of the stories of the ancestors of the area through the light show. And I think one of the features of the weekend has been that the Māori immersion and that sort of experience of Māori culture.
Yeah. Even though you've grown up in New Zealand your whole life, you haven't had necessarily the chance. Just
Yeah.
depends on.
Yeah. I was a little surprised about that actually. How
Yeah.
many people hadn't stayed on a marae or had much to do with Māori culture actually. So after the marae,
After that,
we
surfing.
went surfing.
Yeah.
So a few people walked over the hill.
Yeah.
Yep. But not very many. Most of us went surfing.
And paddleboarding.
And paddleboarding and stand-up boarding. That was
Yeah.
amazing.
Yeah.
Were you one of the ones that went disappearing
Up
off
to
into the? Was
Yeah,
that one
yeah.
of you? Tell us about that. What was going through your mind?
So Beaver told us to head out to the point. So
Yeah.
him being the person in charge, we had to do as he said, and
Yeah.
went out to the point. Saw the little cove from a different perspective for the walkers. So
Right.
double winning, I think.
It was a little bit alarming for those of us on the shore, I
Yeah.
have to say, watching you disappearing off into the distance. But it was good, and I think most people, I don't think, well, I'm not sure, did Brian manage to stand up?
Yeah, that's how, I'm pretty sure everyone managed to stand up who tried it.
Yeah, but Brian ended up with quite a badly sprained ankle at
Yeah.
the end of it, which was not exactly ideal.
So how's it going? It's Brian again checking in. Had a bit of an accident. I had 3 girls pull the sweatsuit off me. It's not as enjoyable as it sounds. I promise you that. Getting dragged out of the water by Dr. Scott Jones was top-notch show. It was properly good stuff. It was like Baywatch stuff. Yeah, he came running down, and grabbed me and dragged me out. It was momentarily painless because I was filled with like adrenaline. I was blushing, but yeah.
So then we headed to the surf club.
Then we headed to the
Yeah.
surf club and
Had a barbecue, which I thought was dinner,
right,
but turns out it wasn't. Turns out there was more later.
yeah. Food's been quite a major feature of the weekend.
Definitely for me.
Yeah. And
Scottish dances.
Scottish country dancing. The local Whakatane and Opotiki Scottish country
Yeah.
dancing groups led us in a few jigs or reels. I'm not quite sure what you call them.
Yeah.
Normally in a ceilidh there's lots of dancing, and then while people catch their breath there are items like somebody singing a song or telling a story or playing an instrument.
And that was so much fun. I was actually interesting listening to some of the students saying, I really saw it on the program. I wasn't quite sure what I would do, whether I'd really like it, but no, everybody got really into that, and that was cool. And then some of the Scottish country dancing people stayed to help us with the professional speed dating.
Yeah.
How did you find that?
I thought that was really interesting, that there was someone from each background. So I met a physiotherapist, I met patients,
Yeah.
and it was really interesting hearing about, like, they have all had experience in bigger city, like bigger hospitals as well. So they appreciate both sides. It's not like they've always lived in Whakatane and that's all they know.
Yeah.
So they know what it's like. They're
Yeah.
not blank to the city life. I found it really good actually.
Yeah, it was quite noisy, wasn't it?
yeah. Things got a bit rowdy.
Things got quite rowdy. It was really hard getting people to move on from their date, actually. That was anyway.
So then this morning we went for school sessions, and that was really good as well, bringing a bit of education into it.
Yeah. So there was a CPR,
airways sort of station.
Station with
and
Matt
then
Valentine from the emergency department here in Whakatane.
he was amazing.
Temptation is to rotate it because you can get some torque on it, but the thing that you're getting torque off of is the patient's upper teeth, and you'll break their teeth. And in New Zealand, that will get you in trouble, and in America, that will get you sued. So we avoid it. People don't like it.
Yeah.
And then Mike Claassen, who's a local surgeon, private surgeon, led a suturing workshop.
Yeah. There was
Megan
sexual.
Ruha, who did health literacy.
Yeah.
And Joe Garner did the sexual health history taking. How was that?
That was really, really good.
Yeah.
It is always an awkward topic to bring up with people. And the way she did it, she was very chilled out and she just asked people. And if they don't respond to that, she'll see what they sort of respond to and go with that. But her open approach and just putting it out that she's going to ask awkward questions, and I think I'll definitely take that.
Yeah. So there's been another event over the weekend as well, which has been quite momentous, which was the removal of my moustache.
Yeah.
So the I hadn't really enjoyed having a moustache.
You haven't?
No, I haven't really enjoyed having a moustache, but I did begin to realise that people were perhaps noticing it more and more, and talking about me behind my back a little bit about it. You know, once the extent of just how bad the moustache was had really sort of penetrated, then I consented to the operation that needed to be done in order to remove it. So, and I actually say I feel liberated now. It feels like I'm almost back to normal. Well, it's certainly a new man, but in terms of normality, this is probably as close as it gets.
Close to baseline, I'd say.
Close to baseline.
Yeah.
But no, it's been a great weekend, and I'm really looking forward to the next 11 months without a moustache.
Yeah.
So once again, good morning from the beautiful sunny city
Good morning.
of Whakatane. I'm here with Manshu, and this will be our last check-in for this amazing trip, really. Manshu, would you like us to just run us through what some things we've accomplished?
So much in so little time. It was actually funny, we were having a dinner with one of the orthopedic surgeons yesterday.
Yeah.
And he asked us what time we came. Had to think about it twice. It's like, I think yesterday night, just couldn't believe it. We've done so much in just so little time.
Yeah, it's just been such a culturally broadening experience, and amazing hosts have really made this trip very special for us.
The people here have been so welcoming and friendly and made it so fun.
And as students, the food can't be beaten, really. It was something special.
Puts a smile on my face every time.
And not to mention, we're in this beautiful, beautiful city that the weather has been spectacular, and it's just been such an amazing trip. It'll be quite sad to go, but something that we can definitely look forward to in the future to really get involved with this Grassroots immersion program. Yeah, and we'd just like to mention Papa Joe one more time, Dr. Joe Scott Jones. He has been absolutely inspirational, and he has been really a guidance for us in bringing us through this journey. And if there's one thing that could win us over to come to Whakatane to pursue our careers, Papa Joe probably be it. Yeah.
Papa Joe's moustache could not be it.
Couldn't. Exactly, but it will go. It will go. So once again, this is Brian and Manshu. This will be our last check-in for this amazing weekend, Whakatane weekend, and we hope to come back here and enjoy this beautiful place once again and its people. Thank you very much.